So we put the pads on his chest and we put in another IV. And again, the doctor at this time at least presented at the door said to me, well, he looks fine. He's not yelling. He's not screaming. He's laying there pretty stoically. He looks fine. Long story short, nothing was really happening. So after the 2 hour mark, I left the room and I said to the nurse, do you mind if I step out for a few minutes? I went out and I went to the nurse's desk, and the doctor's sitting there on the phone trying to sell this patient to Winnipeg, trying to convince the COVID unit to take him. But the COVID unit won't take him because he's not stable, because he's an SVT. But they won't take him upstairs to cardiovert him because I don't want to expose anybody unnecessarily to COVID. So we're just going to watch. So at this point I said to the doctor, so what is the plan? What are we doing with this patient? What are we going to do? And the doctor said to me, don't look at his oxygen. Don't look at his heart rate. When he's sick enough to tube, then call me. And the amount of people that stood at that desk, the respiratory therapist was there. The manager from the ER was there. All my colleagues that were listening to this happen were witnessing this. I was like, so you want me to chart that? I went back into that patient's room, and the only thing I could do for that man was stand at his bedside and pray for him. Because that medical system that he was in wasn't willing to do the care that they needed to do to help that man. And I prayed that God would just heal him, to heal his heart, to bring it back to a normal, stable rhythm. And after 2 hours and 45 minutes, his heart converted on its own. That gentleman stabilized, his oxygen improved, and he went home to his family. That is just one of literally probably 50 stories I could share of the things that I saw and experienced, where doctors were making choices not to treat patients. It used to be that when a patient came into a hospital, we'd fill out a form called an Advanced Care Plan, ACP. So that form has 3 different levels on it, R, M, and C. So R means resuscitation, M means medical care without resuscitation, and C is comfort care. In the past, that form used to be completed between the doctor and the patient, or the nurse and the patient, and that would decide and direct the level of care that the patient would have in the hospital. So it seems like in COVID world now, people don't really have that choice. Even if they want to be resuscitated, even if they want us to do everything we can, there are doctors that are choosing that isn't what the plan is. And sometimes even without discussion with the patient, no, they're not an R. We're not going in there to resuscitate them. I've heard come out of a physician's mouth. And yet that patient believed we were doing everything we could for him. That patient was 43 years old. That patient isn't with us anymore.